Today I want to bring your attention to number one cause of cancer deaths in this country, that is cervical cancer. You'll be surprised to know that every 7 minutes we are losing a woman in this country as a result of cervical cancer. This amounts to 200 cases of cervical cancer deaths per day. Through this video, I wish to bring to your attention that the cervical cancer is 100% preventable, and it's very easy for any woman to get this prevention done totally. First, let's understand how the cervical cancer is brought about. Cervical cancer is opening of the uterus. It is caused by HPV infection, that is human papilloma virus, and once this infection finds its way into the cervical epithelium, it stays there for a long time, and once abnormal changes starts taking place, and if it is not treated, it can lead to cervical cancer. Contrary to its belief that the cervical cancer is hereditary, it is not hereditary at all. It is caused by a virus, that is human papilloma virus. The HPV infection stays in a woman's body for a long time. If it is not cleared, then only it leads to cervical cancer. Cervical cancer usually does not have symptoms. Once the symptoms appear, usually the disease is very late, that is, an advanced stage of cancer is found at that stage. Fortunately, cervical cancer can be prevented 100% by HPV vaccination and by regular cervical screening from age 21 to 65 years. As regards vaccination, according to WHO, the best time to give HPV vaccination is prior to girls' exposure to HPV infection, that is sexual debut. Currently, the vaccine is in 3 doses, which need to be given in 6 months' time. Like any other vaccination, there are some side effects of HPV vaccination. They are very, very minor. That is, there can be slight fever, there can be redness at the injection site, slight irritation, and that's all. No major side effects are known as of HPV vaccination. You'll ask me about the screening. The screening is aimed to detect HPV infection and early stages prior to cancer. And in case if it is treated at this particular time, it is 100% preventable cancer. Regular screening is done by pap smear and HPV DNA test. As I said just now earlier, that it is recommended from age 21 to 65 years. After 65 years, there is no need in case if there has not been any prior history of dysplasia in this particular patient. Cervical cancer is one of the very few cancers which is 100% preventable by HPV vaccination and cervical screening. I bring to your attention that you have to take the first step of its prevention. If you have any queries regarding the vaccinations or regular screening for cervical cancer, please get in touch with me.